Welcome, this is CB Bunkhold from Ultramed Acupuncture. This video is on prevention strategies for the COVID-19, things you can do just to maintain good health. Here's a recipe for a ginger, lemon, and date tea. There's a picture of the ingredients that can be put into 1 cup and pour boiling water over the ingredients. Let it simmer for 20 to 30 minutes and then enjoy. Drink 2 cups a day. That would be sufficient. You can definitely drink more if you like. And then on the right is a picture of a product that we found at one of the local co-ops. I believe it was Trader Joe's, and it's a lemon, ginger, cayenne, apple cider vinegar blend, which seems like it would be perfect for this sort of a situation. Okay, how much vitamin C to take? And they have been using high doses of vitamin C intravenously to treat the COVID-19. How much vitamin C would be a good dose for you? Well, here's how you can find what's referred to as a bowel tolerance. And once you find where the stool starts to become soft, then back down on your dosage by about 500 milligrams until the stool firms up. Vitamin C can be very good for boosting immunity and fighting infection. What herbs to use? Now, the COVID-19 is considered a cold pathogen, as it presents with clear phlegm, mild to no fever, chills, chest congestion, things like that. So at this point, there's no signs of heat. So that's why using warm herbs or hot herbs like ginger and cinnamon would be very good for this. So even at the early stage of the invasion, this could combat the virus. Now you have two different sets of herbs here and 2 different schools of thought. This is my personal belief as a herbalist. Other herbalists may agree, some may disagree. When you are not preventing and all you're working on is protecting yourself and boosting immunity, then using herbs like astragalus root or ginseng. Specifically for this, the red ginseng, like the Korean or the Chinese ginsengs. Those are warm and they work specifically on the spleen, among some other organ systems, but boosting the immunity. Now, some people may want to, they think, well, this is a virus, so I'm going to take antiviral herbs like Coptis or, Banlangan, Echinacea, golden seal. Those herbs are meant to fight pathogens because they boost white blood cell count. So they do have antiviral and antibacterial properties. So my personal belief is not to take these unless you present with symptoms. So upon an invasion, that would be the appropriate time to take the antiviral herbs. Now, these specific antiviral herbs, with the exception of the garlic, are cold in nature because we think of viral pathogens as producing a lot of heat, high fever, a lot of thirst, sweating. That would be a heat pattern. The cold herbs will eliminate the heat. So for early stages of the COVID, because it's a cold virus, these antiviral herbs I have listed, with the exception of garlic, that's very hot, these herbs are not appropriate. They would not be appropriate until about the 4th or 5th day of the invasion when the actual fever sets in. And now you have more heat signs. Then it would be appropriate to use those. So here's a couple common points that you can use for your own self-acupressure or Moxa. So Moxa, This is a Moxa stick. So it looks like a big cigar, and you light the end of it, and then you can locate large intestine 4, which is very common. And then if you were to just wave this over or just kind of go up and down till you warm the point, just be careful not to burn yourself, but you're just warming. And if you don't have access to one of these, I do have some, or you can maybe get them at an Asian market or something. Or you can just use acupressure. Just use your thumb or your index finger or something to manipulate these 4 points on the body. They are great for boosting immunity and strengthening the organs. So recently there's been a little bit of a scare regarding the COVID-19 and the use of ibuprofen. And so here's a list of common NSAIDs, and I also put a link down here for the FDA website in regards to using aspirin or Celebrex or ibuprofen, and with the invasion of the COVID-19. There isn't enough data to say that it will accelerate the disease or not, or there's any more harm or danger than just normal use of it. So, but you can feel free to look that up on the FDA website. Very inconclusive. So the bottom line is there's a lot of information that's out there. Some of it is true, some is half true, some of it isn't at all true. So you really need to do research. So that's what I'm trying to do, is try to sift through everything and just kind of present to you the basics. Okay, and truly, what is your risk? So, people with emphysema, COPD, asthma, lung issues, obviously they're going to be a high risk. Diabetes, kidney disease, anybody with a lowered immune system, either going through cancer treatment, chemotherapy, or anyone on any sort of a immunosuppressant drug. Heart disease, and elderly. So the reality of this disease is, when you're looking at the statistics, the morbidity rate is usually going to be people that fall into one of these categories, usually 2 or more of these categories. So if none of these apply to you directly, if you were to get sick with this virus, the chances are you're going to come out just fine. There's a lot of people that are very minimal symptoms where things have just passed like a normal cold. So try not to worry so much or obsess about it. Obviously be cautious. It is a real issue here, but try to keep yourself calm and realize that this too will pass. Ultramed Acupuncture will remain open starting 9 a.m. Tuesday through Saturday. Some of the days we may close early due to a lighter patient load, but other than that, we are open for business as usual. I'm also doing a lot of herbal consultation, either by phone or video, and sending out herbs to people who just can't leave the house or choose to stay isolated. So, thank you for tuning in and watching this. I appreciate all the support. Feel free to contact me if you have any questions or concerns. And going back to the herbs, using the single herbs like I was talking about, Echinacea golden seal, that's a great combination. But if you do get something and things seem to be progressing, herbal formulas and combinations like that are clinically proven to be more effective than using single herbs. So feel free to reach out to me if I can be of any help or assistance to you. Thank you and be well.